It seems like the suggested ages for screening may vary based on gender and race and family history. What are the current screening guidelines?
Yeah, so the current screening guidelines, so fortunately, due to this rise, there's now recommendation for starting colon cancer screening at age 45. That's really for everybody. Um, and then there are certain people that really should be screened even earlier. We definitely know that the Black community is affected at a higher rate. So there are some communities or some professional societies like the AGA or ACG that actually recommend starting even earlier in the Black community, maybe even by age 40. Um, and then the other thing I always try to emphasize with this too is, the usual screening guidelines that we talk about are for what we call the average risk population. But I do think that we overestimate how many people are average risk. So one of the things that I think is not talked about as much is that if you have a family history of even polyps, so high risk polyps, that also means that your family members should get screened earlier, 10 years earlier than the age that you were found to have a high risk polyp. But my experience has been, most people don't share with their families that they have those. If you had it done, because let's say I had a colonoscopy done one day and they found those, they get taken out and they just say, "Oh, come back in 3 years instead of 10." But as far as I'm concerned, that's where it ends. But actually, the fact that I had those polyps has implications, for my siblings, for children, and everything. And I don't think most people are in the habit of disseminating that information. And so I think as a
Yeah,
result of that, a lot of people are probably at increased risk and they're really not aware of it.
yeah. Where can patients find the most up to date information regarding screening?
I would say, the best resource to me is the American Cancer Society. Their websites are, they're highly reliable, they're easy to understand. And I find that they're very balanced. They're not going to be overly pushing one side or the other. But they're going to be evidence-based. As we all know, there's so much fake news and misinformation out there, especially when it comes to health. And so, I think having a resource you can really trust and understand is key. And the American Cancer Society, you find, is an excellent resource.